private practice of medicine is extremely important, because in private practice of medicine, in my practice, it's you and my patient, it's, you and me. Decisions that we make are based on what you need, what I can offer, what I think is the best. We go over risk and benefits, informed consent. We decide together.
Exactly.
Sometimes you don't like what I'm telling you. Sometimes I don't like what you're telling me, but we find ourselves somewhere in the middle and go forward. With the
Right.
World Health Organization, what I realize is that would be totally
That would be
gone.
gone. It would be totally
They
gone.
want to tell us how to do it, when to do it, and what we need to do it with.
Welcome to the React 19 podcast, where we bring awareness and support to the COVID-19 vaccine injured and discuss the science, research, and laws that affect all of us. Hi, everyone. Thanks for joining us again today. I'm Ann Forty with the React 19 podcast, and we are so glad you are here today. And I am so excited to be joined by my guest, Dr. Kat Lindley, also known by Dr. Kat to many of us. So, Dr. Lindley, thank you so much for being here today.
Thanks for having me.
Well, many of you who are listening in are maybe very familiar with Dr. Lindley's background because she's been immersed in all things COVID for the last 4 years, and she's been keeping many of us informed of what's going on. But for those of you who have not heard of Dr. Lindley, I'd like to just take a moment to read her bio so that you can come to know why she has become so trusted and sought out for her medical knowledge, and really a lot of legislation knowledge as well. So let me read that here. Dr. Lindley is a Croatian-born, American-trained, board-certified family physician with a direct primary care practice in Texas. She became a family physician because she loved the idea of taking care of the whole family and seeing the family grow. Later in her career, she became interested in helping find solutions to improve the overall healthcare system. She is a fellow of the American College of Osteopathic Family Physicians. Dr. Lindley is also involved with many medical organizations, including the Global COVID Summit and AAPS, and is passionate advocate for her profession, her patients, and her children. She is the past president of the Texas Osteopathic Medical Association and the Texas American Academy of Osteopathic Family Physicians. She is the current president and co-founder of the Global Health Project, a coalition of organizations, experts, and advocates dedicated to improving and protecting the health and future of all humans through education, advocacy programs, and communication initiatives, defending health choice, equality, and responsibility. Dr. Lindley believes that this is the time to ask questions, seek understanding, and collaborate with your doctor to make informed decisions about your health. Her approach to medicine is simple. In her words, quote, "I always felt that medicine is about humanity, spirit, mind, and body. We are all more than the sum of ourselves and functions. We are human because inside our body lives a spirit that needs nurturing through faith, love, and good deeds. Reclaim your life 1 minute at a time, 1 hour at a time, 1 day at a time." And so she is here to share all that wisdom with us. So now you know why I'm so excited. All right. So as I was going through the questions that I wanted to ask you today, this morning I was thinking, no, wait, what are the most important things that the listeners need to know from you? And you know better what the listeners need to know than I do. And so what I'd like to do is to go back to the beginning of the pandemic to get your view. And it's important for the listeners to know that you were raised in a communist country. And so you're coming to America with that view. And so the pandemic starts and you're a doctor, and just tell us, how you felt about how things were going, what concerned you, how you advocated for your patients, how you really advocated for many of us. And then I'd like to talk about your concerns going forward, specifically with the WHO and any other legislation that you think is concerning. You post a lot. I really would have. I'll put your I'll put, just so the listeners know, I'm going to put everything about Kat in the show notes, all the ways to connect with her, the global COVID summit, and any other information you give me, Kat, I'll put in the show notes. So you don't worry about taking notes now. Just tune in and listen, because all that'll be in the show notes. And then finally, I'd like to conclude with just talking about the Revive Clinic, which you'll be working with React 19, that really hopes to give help to the chronically injured, vaccine injured, long COVID. I really think that that could be the beginning of a new approach to healthcare. And actually, you've kind of gone back to a new approach. So anyway, that's a lot, but I just wanted to kind of give the layout for the listeners of where we're going in this conversation. So I hand it over to you. Please tell us everything we need to know.
Thank you. So my life, or at least, how I grew up, does kind of define who I am. So it is important. So I'll try to share some highlights of it. I was born in Split, which is a small, beautiful city on Dalmatian coast in Croatia, and I hope everyone goes and visits it, because you will not regret it, I promise. So I was born there, and this was when Split and Croatia were part of Yugoslavia. Josip Broz Tito was the president of the communist country. I think, I forget exactly what our full slogan was, but we were like socialist communist country, right? And he died in the 80s. I actually remember being a kid. It's like one of those memories that you have and you don't know why. We had to wear, I had to be like 6 or 7 years old, because he died in the 80s. So I had to be like 6, 7 at the most. And I was wearing the little blue skirt with a white shirt, a little red bandana, and the partisan cap with a red star on top.
Wow.
That was like the uniform you wore in school. And I remember, we were on the street, like, waving to the president who came to our town. So I kind of remember that memory, because I was also in the choir and we were singing and things like that. The one thing I remember about growing in communism, that there were a lot of things you were not supposed to talk about. And one of them was the fact that, I was Catholic, we were raised Catholic, and then I was going to church. It was one of those things you're not supposed to talk in school or out, because, and if you wanted to actually advance in any sort of business, because my sister was older and, my dad worked and all that, you had to be part of a communist party. So it was like a lot of things like you're not supposed to do, this whole like kind of environment of fear of authority, of what could happen. And then, in the 80s when he died, the country they all wanted to be part of the leadership. Yugoslavia was made of 5 republics and 2 provinces. So every republic president wanted to be in charge. So there was a chaos for about 10 years, and we ended up with the Balkan War. So when I was 18 years old, I graduated high school, and my family had a feeling that the war was coming. So they found me a job in Italy as a nanny. And Dalmatian dialect is very similar to Italian. I didn't speak the language, but I understood some of it. So at 18, one day, and I swear I remember this, I was with one suitcase in hand going on a ferry from, I think it was from Zadar, which is a town close by, to Ravona, which is an Italian town. And I got on a ferry to Ravona, and then from Ravona, I took a train to a place where I was going to live for the next few years. And I ended up living in Italy. I was lucky, I'm Christian, and I truly feel that God has protected me along the way. I ended up with a great family. I stayed with them for a little while, then went to England for 6 months. And for my friends in UK, it rained the whole time. And I got depressed, and I was like, I can't handle this. So I went back to Italy for another 4 years. And I ended up with another family, and this family had a house in Florida. So we used to go back and forth between Italy and Florida. And during these 5 years, I saved money, and they offered me to stay in their house, and I changed my tourist visa to student visa, and then was able to save enough money to go to college. So I did all my undergrad and eventually medical school in Florida, which I love. It's one of my favorite places. Um, so I was always like, one of those people. I had to grow up fast because I was really spoiled rotten. I am the youngest child in the family.
Oh,
I had like an older brother and sisters who were really like parents. Everyone spoiled me. So, doing this on my own was a huge growth experience for me. So then when I realized, how important is what I'm doing, and I'm truly an example of an American dream, I really got involved with policy early on
mm,
because I'm very much for accountability. In a sense, if you do something wrong, admit it, do whatever you have to do, move forward, and that's kind of like even in medicine, I saw that the system was broken. There's too
mm,
much bureaucracy.
right.
Doctors are leaving private practice, going to be employed. So all of this is, I don't know, I'm also a movie buff, by the way. I have, and just for your listeners, I have ADD. I don't have ADD, but I have ADD of thought. So I'll jump from things to things as they
I can
happen.
relate. I can relate.
Okay, good, good.
I can relate.
So
Whoop.
I love movies, right? And I don't know if you've watched the movie Perfect Storm,
Mm,
which was about this perfect hurricane that hit North England, like the east coast of United States, the
okay.
Massachusetts and that area, right? Anyway, there had to be perfect conditions for this to happen, for this huge
Mm,
event to happen. And this
okay.
is kind of where COVID and what happened in medicine, same thing happened.
Yeah.
Before COVID, doctors were leaving private practice. They started getting employed by big corporations, hospitals, groups, medical schools, universities, whatever. And then when COVID hit, you start having these directives: don't see the patients in clinic, close the office, only first responders go in, tell the patients to stay home until they can breathe. That was a really perfect storm setup for the doctors to
Right.
comply the way they did.
Right.
And I think if we had more doctors in private practice, this would not have happened. So
Yeah.
it's really important to highlight that part of our history in medicine.
Yeah. That Joel Walskog has talked about that. Like when he started, like 70% of the people were in private practice and 30 only, institutional. And that's
Mhm.
flipped now, it's very few that,
100%.
yeah,
And that's why you had a lot of doctors,
you have to do
I
what
don't
you're
want to say
told.
fall for it, but yeah, because like, you work in this system, and, I get asked this question a lot. Why did doctors fall for it? Why didn't they speak out? And I think there is like, it's a very complex problem. So there's many answers, but a couple of them are, first of all, they're employed, part of the system. The system tells you exactly what you have to do. And it's really hard to buckle that system. That's
Right.
one thing. Another thing is like all our medical school training, residency, practice, we've been told that, CDC, NIH, New England Journal of Medicine, Lancet,
The gods
these
of
are like
medicine.
gods.
Yeah. I
Yes,
was just
gods
going
of
to say
medicine.
the gods
So
of
like
medicine.
all of a sudden you start realizing that, like, the Bible is not the book, and you're like, what?
Yeah.
It's like, you mean Jesus is not my savior? Really?
Yeah.
And it's kind of what the CDC part is. So I think like it's important for all of us,
Right.
um, to give each other grace.
Yeah.
And one thing that like gives me comfort is that I'm seeing more and more physicians turning the tide, realizing that they've been
Mm,
lied to.
that's
But they're
good.
doing it, but some of them are not doing it loud like I am, right? They're doing it in their own practices. They're, telling their patients, I agree with you. Yes, you are vaccine injured. Let me figure out how to help you. Some of them are starting to go to different seminars like FLCCC conference or different things like that. And I think we need to really embrace that. And that's
Yes.
kind of what I talk about grace a lot. We are all at a different part of our journey, and we need to allow, you know, other people around us to reach their truth. But
Yeah,
we need
that's
to do it with grace, and because we want them on our side. We want more. We want everyone on this side.
a lot of wisdom there. A lot of wisdom. So then as we go into the pandemic, and you were seeing patients, I mean, what were your thoughts, as you saw the country close down?
So this is kind of where I realized, things were not the way they're supposed to be. So one funny story is like I actually stopped believing in CDC really early on. It was the masks that got
Mm,
me. So for those who are in health environment, if you work in a hospital every year, and I used to complain about this every year because I had to like spend a couple hours and I hated doing it. But every year you have to go with the infectious disease department. They put a clear helmet like structure over your head. You put a mask, a 95 mask on, then they put a helmet on, and then they spray the helmet with certain things.
okay.
One of them is saccharin molecule. If you taste saccharin in your mouth, that means that the fit is not proper and you need to change your
Yeah.
mask. So like for the whole time I worked in the hospital, I used to be a medium. And I always used to complain like, I haven't done anything. I don't have beard. Like, why do I have to do this? But it tells you like the nonsense that we had to go through. So you have to do this mask fitting every year, and then you have CDC. So listen to this. At the beginning, you have to wear a mask, you have to wear goggles, you have to wear a hat, you have to wear a yellow thing, you have to wear booties. You had to wear the visor, you had to wear everything. And then they started running out of it, right? So
Mm.
you lost the hat, you lost the booties, you lost the little gown, you lost the visor, you were left with a mask. They ran out of N95. Let's do surgical mask. They ran out of surgical mask, so they give you like a paper mask that's like nothing compared to actual surgical mask. They ran out of those. At one point, CDC actually said it's okay to wear a bandana.
Yes, I remember that.
And
Oh,
that's kind of where I
yes.
knew that whatever they say from this point on is just,
Oh my
not
gosh.
something I'll trust.
Yeah.
So, so that was like one aspect of it. And then the other aspect that really got me was I recognized the fear. I recognized the propaganda. I recognized, and I watched TV at the time, the Fox News and stuff and different things.
Mm,
And the ticker always went up. It was always red. The numbers kept on jumping at you.
mm,
And then there were pictures from New York, pictures from China, from Italy, and they all were doing something. They were increasing anxiety around us.
mm.
Then they said, you cannot go anywhere. And I was, first responder. So I actually was always able to go, but most people had to stay home. You can't go anywhere. You can't talk to anyone. You can't go to church
Mm.
because if you go to church, you'll actually talk to people and say, this is all, nonsense. You can go to school. Then they start bargaining phase. And bargaining
Mm.
phase was, well, if you keep 6 feet apart, you can stay in line for this. And then, well, if you wear a mask, you can go to the restaurant. And while you're standing, you have to wear the mask. But when you sit down, you can take it off. And then eventually we came to that vaccine, the injection part. And at the time, it was, well, if you get it, you can travel. You're going to protect your grandma. You're going to protect your neighbor. And then people are not really buying it. If you don't do it, you will lose your job.
Right.
And that's where truly the things started turning. And what I recognize during these phases is this totalitarian attack on our freedom. The other thing, I'm very much connected around the world because, coming from Europe, I have lots of friends everywhere. I understood that the messaging was the same everywhere. this has never happened.
Never.
So you had to question it. Why is it happening to this point? Why are we coordinating the messages from one country to another, from one continent to another? And then I actually got involved with the World Health Organization. I know we'll talk about it later, but I got involved with them really early on
Okay.
because they early on in 21, they were starting these talks about how we need some kind of agreement, treaty, conference, something, so that we can respond better, we can do things better. But they never addressed everything that they've done wrong. And then as this document kept on changing, I started seeing more and more ways they were trying to control. And as I said earlier in this conversation, private practice of medicine is extremely important because in private practice of medicine, in my practice, it's you and my patient, it's, you and me. I actually don't take insurance, so there's no even insurance in the room with us. It's you and me. Decisions that we make are based on what you need, what I can offer, what I think is the best. We go over risk and benefits, informed consent, we decide together.
Exactly.
Sometimes you don't like what I'm telling you, sometimes I don't like what you're telling me, but we find ourselves somewhere in the middle and go forward.
Right.
With the World Health Organization, what I realized is that would be totally
That
gone.
would be gone. It would be totally
They
gone.
want to tell us how to do it, when to do it, and what we need to do it with. And that's kind of where I got involved more on the global platform.
So, in your work now, you yourself, when COVID started, did you already have your practice set up? I don't remember. I remember listening to something where, you kind of phased into having your own practice, but I don't know where that was during the COVID.
So I actually opened the practice in 2017, but I was kind of still building it.
Okay.
And I worked in the urgent care for the hospital that I was a medical director of their outpatient clinics. So as I left that position, I kind of stayed with the urgent care to supplement the money while I was building my practice. So it was kind of interesting because I experienced it from two point of views. One was, in my private practice, I started reading different journals. I was connected to a lot of these great doctors, and I took care of my patients as the protocol evolved.
Right.
I changed, but my patients did well. And then I was in urgent care where we were told not to see anyone who came in with, and they had to call the clinic to say what's wrong with them, and then we say they can come in or they need to go to the ER. I ignored it most of the time, and I had patients come in, but essentially we were not allowed to see them, and I could not prescribe early treatment through that clinic, but at least I tried to help them as much as I could.
So through your
So it was
own
interesting
practice,
to see
the contrast.
it was interesting. It was huge contract because my patients really did fine.
And were you able to prescribe the things that our government did not want you to prescribe or were recommending against?
I'm really good friends with Mary Talley Bowden.
Okay.
And some of the trailblazers.
Yeah.
But I'm one of those people, since I know what it means to challenge the authority, I don't do it unless I have to.
Right.
So what I did, I prescribed everything, but I found a compounding pharmacy. I found a pharmacist that I knew would allow patients to have this. So usually I didn't have any trouble. Knock on wood, I didn't get reported to my medical board or anything, because there was why would I fight this system when I don't have to?
Right.
And that's kind of, I think, where, being in private practice and, and I have 5 kids. You fight the battles you want to fight, not every single battle.
There you go. Yeah, you nailed that one.
You know this. Yeah.
Okay. So you're then, for the most part, the patients that you saw did fine through COVID.
Yeah, I had a couple that end up in a hospital mainly because they need a little bit of supplemental oxygen, but they all luckily came out fine. None of them, I don't think any of them received remdesivir. I had a couple that did get remdesivir, but I kind of inherited them later.
Okay.
So yeah, I was really lucky It was
So,
very stressful. I have to tell you, it was probably one of the most stressful time of my life because I worried about every single patient.
well, I
But,
think of,
you know,
when you hear Dr. Merrick speak, um, the patients that he knew he could have saved, but he wasn't allowed to. He couldn't treat them. It was so heartbreaking. And it's just
yeah,
amazing to me that people in the agencies, like Anthony Fauci, he never even treated anybody. I mean, they're not even, seeing patients and or treating people, and yet telling people like you and others, no, you can't use this, you can't use that. And I mean, we all kind of know where this was leading to with the vaccine and all of that. So your concerns now, you've lived through this, you've seen what you've seen, you've come from an authoritative country. Now we're kind of coming out of this, although we still have vaccine mandates at, what is it, 35 colleges or so. Um, and we have the, WHO Pandemic Treaty now kind of breathing down our necks. This is all coming to the head. Tell the listeners a little bit about the WHO Plan Preparedness Treaty. I
sure.
think that's what it is. And your concerns about it if all these countries sign up with it.
So before we go into the World Health Organization, I think one of the important things to also speak about is the system that has truly been kind of it's totally broken. It's wide
Mm,
open right now. There is this big chasm in the middle that I don't know that we're gonna be able to actually, you
yeah.
know, fill and everything. And so this is important, I was actually on World Council for Health during a period of time. And one of the things that we highlighted there with some of the works that I did and others was the pharmacovigilance
Okay.
aspect of what's happened with the vaccine rollout.
Right.
Um, in the past, we've had different products that have been rolled out, and then there were series of events of the adverse events that were reported, and the agencies did their job.
Hmm.
They decided to stop it, look it over, decide if they want to continue or completely take it off the market. One of the important things that has not happened during this time is the fact that we had millions and millions across the world, all of the pharmacovigilance data, the VG access, the UK data,
Right.
our data, VAERS, and everything. An agency kept on ignoring it, and they keep on ignoring it. And I think that's one of the reasons why people do not trust the system anymore. Because, people always say, like, why did they do this? Are they trying to kill us all and stuff like that? I don't know.
Right.
I
Right.
didn't sit at that table when they were making these decisions.
Right.
But one of the things that I think should have been done by all the leaders of different countries, our own and different others, is say, we did what we did with the data we knew.
Right.
This is what we came up with. But now we are seeing it's failing. People are dying. Lives have been affected. I'm in a chat with the GCS docs, and yesterday one of them reported, and she was asking for advice. What do I do for this family? 14-year-old young adult who was put on a ventilator and had a heart attack. I'm sorry, that didn't happen before. We need to acknowledge this. There is this huge amount of suffering happening that we are ignoring and not acknowledging. And then at the same time, like after I read that, a couple hours later, or was it this morning? I'm not sure. I think it was last night. The CDC director said, first of all, we approved the ninth
Yeah.
booster,
I saw
and
you.
then
You
and then
posted that on Twitter. I saw
yeah,
your post. Yeah.
and then I
Yeah.
posted today. CDC director said, please
Yeah.
get used to the fact that we're going to have the 10th booster in the fall,
Right.
and really consider it. And I said, I did consider it, and my answer is no.
Yeah.
It's like,
It's
come on. It's like, don't you think it's a time to say it's failed?
and you raise such a good point here in that So when the vaccine first started coming out, and I was keeping track of all the adverse reactions I was seeing from all over the world. I have a website, and so you could go back from 4 years ago now, where I was updating all the different country sites and how many AEs were taking place and all of this. But, so you have those direct things where people were reporting. But then last night I listened to Joel Walskog's presentation that he made at the FLCCC convention a few months ago, and where he talked about, how a third of the VAERS reports were deleted. Then there's this kind of backdoor at the VAERS. I mean, all of that. But then I have some friends, who are dealing with aging parents or whatever, but one of the things he talked about was the AE of having urinary tract infections. Like, that was really high. Well, one of my friends, her mother has had one UTI after another after another. She's had a stroke. Her father is like delirious. I mean, he's lost his mental cognitive abilities. And you would think, okay, nobody's attributing that to the vaccine, but how do we know it's not? You know what I'm saying? Because they had like 3 shots, so there's all these other things that are going on that nobody's even, I mean, not only do we have, the pharmacovigilance data, but all these other things that could be happening in people's lives that nobody's connecting the dots. I mean, you and I might, Dr. Corey might, Dr. Merrick might, but we have no idea. So you're right that if we could just come and say, hey, we have to examine this, instead of saying, hey, get ready for your 9th booster. And that's a problem.
It's just incredible that, for example, if a child comes in with a strep and I give them amoxicillin, and the parent texts me 2-3 days later that the child developed a rash,
Right.
I will put amoxicillin as an allergy.
Right.
And I will not give the child amoxicillin because I'm not sure the next time he will have a more severe reaction. And now we have something where people have come and went to the doctor. They were healthy people, whatever. And they're like, they had this thing and then something happened. Well, common sense medicine is like, okay, you had this one new thing and something happened. Well, maybe it's that thing that caused it. So let me think about if I want you to take 2nd, 3rd, 4th, and 5th. And no, you had doctors say, no, you can take the 2nd one, it's going to protect you.
Oh, I know.
And then
Joel
people
talked
get the
about that.
2nd or 3rd one, and actually their adverse events multiplied, and not like by factor of 2, but probably, the factor of 10 or whatever. So it's just like, it seems like we lost our universal common sense, and the amount of gaslighting that we have had in our community on both sides, whether it's a doctor to doctor or doctor with patient, whatever, is just incredible. And I think we need to return to this center and really common sense medicine and say, you know what, this is not working. Let's abandon this platform. Let's look for something better. And first of all, at this point, COVID has become a milder and milder and milder disease. Some people who may need help during their COVID episode right now have some underlying risk factors, and we're aware and we can help them.
Right.
We need to start moving from vaccine being an answer to every little thing that pops up in the world, because that's not how you deal with it.
Right.
You need to deal with it with common sense again. I go back to my roots, Mediterranean roots, a lot. You are what you eat, you are what you drink, you are how much exercise you do, you are how much sleep you get, you are how much stress you have in your life. That's what you are. And that's how you actually repair, by taking care of your body, your mind, and the spirit.
Exactly. What
And
you
that's
said.
kind of,
Yeah.
that's kind of where my osteopathic mentality comes in, but it's also the roots of who I am. There's so much that we can do on our own that we don't need a pill or vaccine for every little thing in the world. And this is kind of where we can talk about World Health Organization.
Yes.
Now I can tie it all in.
All right. Tie it all in.
So during the pandemic, the World Health Organization and different governments and organizations like Bill Gates Foundation, Gavi Alliance, Wellcome Trust, they all got together and said, well, we need to really do something. So if something bad happens again, we know how to do it better, faster, and together. And they started working on the pandemic treaty. And while they're doing that, they're also amending international health regulations. These are two different things, and I need to address them both differently. So let's talk about international health regulations. That's actually an agreement, an international law that we passed, all of the member countries have passed and adopted it as part of our international agreements in 1969. These international health regulations were amended in 2005. I believe they were a little bit amended in 2022, and now they're trying to amend them again greatly by 303 amendments this year. Important thing to know is that once they vote for the amendments in the World Health Assembly, these amendments don't come back to Congress. They don't come back to Senate.
They don't.
No, they don't. We have already adopted them. So we don't have to ratify them. We don't have to agree with them. The only way out is for us to say, you know what, thank you, but we don't want them. So we have to do that extra step. We have to say we don't want them. And you have a certain amount of time. They changed their time from, I want to say it's 10 months now. Okay. Don't quote me that. It's 10 or 12 months after they're passed. You have time to say thank you, but no thank you.
Okay.
So that's a different thing about amendments. There is no brakes on it as far as our Congress,
I don't think
House
I knew
or
that.
Senate are concerned. Yeah, so that's why amendments are important.
Okay.
And now you have pandemic treaty, which is doing the similar job that the amendments are doing, a little bit different. They're starting to put the financial background, bureaucracy behind this so that these things can support each other. But the treaty has to go to our Senate. Once it's approved in the World Health Assembly, has to go to our Senate. Our Senate has to ratify the treaty by 2/3 of the vote. Now, Tedros and WHO is kind of like, well, let's not call it a treaty. Let's call it an agreement, or let's call it an accord, or zero draft. Because if you don't call it a treaty, maybe the countries will forget that they need to ratify this thing, and they'll just say, "Hey, we'll comply." So you have to be. I know. I can be really silly when I'm explaining this, but sometimes you have to like really bring it down.
No. I'm just like,
So anyway, so now you have these two things, the amendments that don't have to be ratified in Senate or House, and treaty that has to be ratified in Senate. In the meantime, what are they trying to do? They're working together. It's like two horses in a race. Whichever one wins, we lose, by the way. So keep that in mind. But what they're trying to do, and I'll address them kind of together on this point. There's different articles in both of those documents. In the amendments to international health regulation, there is an Article 18. Article 18 says, if Director General declares a public health emergency of international concern in a country, in an area, first of all, the country doesn't have to agree to that anymore. In the past, they had to. Now they don't have to. He declared it. It is. Okay, so he declares
that's dangerous.
I know. He can then order what type of treatments, diagnostics, vaccines, exams we can do. He can close the border. He can institute digital passport. He can order isolation, quarantine, and not allow travel from that area in and out. So, in essence, he can do whatever happened these past 4 years on steroids type of a thing. And he decides. Once that happens, some of us say, first of all, that's an attack on my personal sovereignty. But it's also an attack on our state sovereignty because he just closed our country and said you can't do anything. Right. You can travel in and out. You're on lockdown until I say you're not. And you have to use these products on your people, right? That's an attack on personal, state, and national sovereignty. Yeah, exactly. So I think, it's important for people to be aware of this. It's important for our country representatives to get us out of it. The only problem for us in particular is that our health and human services is the one negotiating the amendments. They have submitted most of the amendments, and they will agree to those amendments. So unless we have a change in administration in November, we will be stuck with these things. And it's not going to be pretty. You're going to have a supranational agency pretty much keep us in the perpetual state of pandemic,
Wow.
be in control of global health, essentially, and decide how medicine and how doctors can treat their patients. I don't know if you remember, but like last year at some point, there was this scare of monkeypox.
Oh, right.
CDC, it was so funny. CDC said like, you need to get like a vaccine or something. And I remember talking to Dr. Ursa Richard. I was walking and I called him. I said, still telling people to get the vaccine for this. They should just tell them to wear condoms. Like it makes more sense, but anyway, and then on the other side, your WHO director, he went in front of the committee and said, I think this is a public health emergency. We need to do something. His committee said it's not. He overrode his own committee and said it is.
So, that brings
So
me to the point
this,
because I heard him Tedros say, oh, this is just absolute nonsense. People who are telling you that you're giving up
oh
your
yes,
sovereignty, that's just fake news. And I think I've heard him say that.
you have. And I love to tweet Tedros. I don't follow him, but somehow he ends up in my feed every time.
Yeah,
I think it's
that's
because
mine
of
too.
because of my followers. So it's their fault that I see his tweets. So I love to quote him on that because it's not true. First of all, he can, maybe on technicality, he could be not completely wrong because the pandemic treaty itself doesn't talk about this Article 18 in amendments. But like I said, these two documents are working together.
Right.
So yes, they do affect our national sovereignty. And I usually reply to Dr. Tedros that maybe he should go and read his own documents and stop talking about pandemic treaty only and address the amendments to international health regulation that he
Okay.
never does. He never talks
Okay.
about them. He can't because there is Article 44 in the, I'm sorry, you can tell I'm really excited. This is one of my
No,
favorite
it's
topics.
good. It's good. We need people
So
passionate, know this.
I talked about it so much today. There is Article 44. I did an interview in Italian, that's why I was late for you. But anyway,
Oh
there
my.
is Article 44 that actually will let Tedros and WHO have narrative on health issues. And if you and I talk against it, we can actually be censored, and our country is supposed to deal with us accordingly. So
Right.
not only,
Right.
so he's attacking the freedom of speech, and that's our First Amendment. Then there is also Article 1 in the amendments. This is an important one. I should have mentioned it earlier. In the past, WHO would issue recommendations and say, we think you should do this, you should do that. And they changed the language from these recommendations being non-binding recommendations to becoming binding recommendations. So, English is my fifth language, but if I translate binding recommendation to an English word that makes sense, that means it's a mandatory obligation.
Okay.
So he's taking the word non-binding, leaving binding obligations. And another thing, the word shall is 168 times in this document. Again, I looked up in English dictionary to see what is the definition of shall. Shall is a verb that says you must do this. So if the document says the state, the country member of WHO shall do this, that means you must do this.
Right.
So let's not forget that they are giving us the orders on how we need to conduct our way of life. And this is why it matters. I really hope, I know like people are going to see this, but I really hope that and I'm kind of smiling because this whole thing is so ironic. I'm trying to make it simple for them to understand that this is a big deal. This is huge. You cannot have a supranational agency tell every country in the world how to conduct life, how to treat patients, how to take care of others. There's this whole One Health agenda they are trying to push. And One Health agenda says the life of a human is equal to life of a plant, to there's three things: human, plant, and animal. And it's all connected with the
Wow.
climate change, people. So you have climate change, health of human, animals, and plants. That's life on Earth. And you want World Health Organization to be in charge of it. I hope to God that someone listens to what I'm telling them and takes this to heart. This is a big, big deal. We will not recover from this.
So to anyone who's listening, anybody who's listening, what would you tell them to do? Like, just, okay, I hear what you're saying, Dr. Cat. What do you want me to do?
So there are several organizations, including Global Health Project, the Global COVID Summit. I'm the one that keeps talking about it on our side. But there's also Sovereignty Coalition I'm part of. It's sovereigntycoalition.org.
Sovereignty,
Dr.
sovereignty, what was that?
Sovereignty
Coalition?
Coalition.org.
Okay. I'll put that in the show
I'm
notes.
also helping Dr. Meryl Nass with her doortofreedom.org.
Okay.
And there are documents on all of these websites. We actually are creating a one-pager resolution that every person in the United States can take to their precinct or county,
Okay.
and then have them county by county passed until the governors and AGs in the state realize this is a big issue. How do we protect ourselves? This is the way. Constitution, right?
Right.
If you read the documents, WHO, the treaty, and the amendments, you will realize that this is an attack on First Amendment, 4th, 10th, and 14th, I believe. And please check me on this. There are people that know their constitution a lot better than I do. But when it comes to specifically to 10th Amendment, the health of the people is under the states. The police power is under the states. So what states can do is pass legislature, or they can have their AGs pass different laws or resolutions and things like that, where it says that whatever WHO does, whatever a federal government agrees with, the state will not comply when it comes to the health of its citizens.
All right.
Because this is something that we can do in the United States specifically. So, I will publish the resolution. We actually just had a meeting before this one. We were finishing touches on it. The resolution will be available to anyone. We'll put it on Sovereignty Coalition and Door to Freedom. I'll ask the Global Health Project to put it as well. You can download the document, agree with it, modify it however you like, take it to your precinct, to your county, pass it, send it to your AG, send it to your governor, ask them to do it on a state level. And for the legislature that's in session, talk to your representatives, see if someone will write a bill. There is a bill I testified for in New Hampshire.
Yeah, I watched that. I'll put the link to that.
And my testimony is available, and I'm happy to email it to anyone because it's pretty self-explanatory. But it was Bill HB 1156 in New Hampshire. It did pass the committee, and it will go.
It did
on the floor. Yeah, pass the committee. It will go on a floor vote soon. So that's one thing we can do, because
that's
currently,
encouraging.
as you're aware, on a federal level, the Biden administration supports this. So unless we have change in leadership,
we don't know. I mean,
we can't do much.
And I, as you say this, I think everybody needs to know that anything you do matters. So many of us were never really that politically involved until, mandates and all this other stuff. And don't be afraid just to pick up your phone and call your representative. go down. I find the easiest things to do are just to go to your county commissioner or your county council
Yes.
meetings. Those are taped. You typically get 3 minutes to speak. So time yourself because they will cut you off. But and just go down there, just prepare something, just put something together, just get on record. Because if everybody who knows about this would just start, go to a meeting, another meeting, these are simple steps that just need to happen. Like if we have been given the opportunity, we've been given the tools. Our Constitution gives us the tools to stay free if we as a citizenry pick up those tools and use them. But we have to pick them up and use them. So I just want to encourage anybody who's listening. It is simple. This is not difficult. And if we all get involved, know who you're voting for. I mean, I want to be careful here because React 19 cannot endorse any candidates or anything like that. But I'm just saying you go find out where your candidates stand on medical freedom. Where do they stand on sovereignty? Where do they stand on censorship? And so, yeah. So, okay, you've given us. Is there anything else we should know about the WHO or any current legislation in the United States? I don't know if there's, well, I mean, we have the big Missouri, or it's Murphy versus Biden now, the censorship case that we know about. But as far as the WHO is concerned, or any other laws that you're concerned about currently pending in the US, are you aware of anything? Or is the WHO really just the main focus right now?
So, there's several good legislature around. I think Idaho is actually doing some very
Okay.
good stuff when it comes to, vaccine specific concerns. And also, I believe they passed a bill when it came to the food supply and the
Okay.
vaccines and different
Okay.
things. So I think Idaho is a good one to watch. Texas, right now, we're not in a session, and we're more, we have issues with immigration, so that's obviously a
Right.
huge issue for us. If you go to doortofreedom.org specifically, there is a list of states that are trying to pass different bills for WHO. If you want to look at some of them and give them to your representatives as an example.
Okay.
On a national level, I love Senator Mike Lee. He has exited the UN bill
Okay.
that Chip Roy has co-sponsored in the House,
Right.
and I believe Massey has signed on. And then a representative from Arizona, I always confuse his name. He has the WHO bill that's important. So there are a couple of things, but again, on federal level, it's a little bit harder. The other thing that I want to say before I forget, if you testify in any of your places, precinct, whatever, like you said, first of all, 3 minutes, and also write down the testimony and give it to them because
Oh.
it's entered as a public record.
Oh.
And
Okay. I didn't know that.
you can give them more material as a background in
Yeah.
your testimony, so they
Right.
can read if they're interested in reading it. So that's always good to have paperwork. And you
Good
can go
point.
on sovereigntycoalition.org or doortofreedom.org specifically to get
Okay.
WHO background paperwork that you can submit. And again, for those who follow me on Twitter, I'm KL Veritas, Veritas.
Right.
In my feed, there is a testimony from the New Hampshire, and I
Right.
attached the document, and anyone can share the document. You can't really
Great.
message me on Twitter because there are a lot of people out there, so I only keep messages for the ones I know.
Right.
But if you respond to my tweet or something, or have a message for me, I tend to really read the answers to my tweet and try to respond to them. Plus, you can always reach me through React 19. I actually do have an email. It popped up
Okay.
for some reason. I have a
Uh,
React 19 email for something, but I also have a Proton mail that people can email me on. It's
must just take a lot just to
kathlinley@protonmail.com.
it must take a lot just to check all your messages over here.
And I'm one of those weirdos. If I see like a number next to my messages, I have to that red little thing drives me nuts. So I don't have any red things on my phone. So I actually do
Okay.
look at them.
Okay.
So yeah,
So
a little bit. crazy like that.
So you've got all your messages, you've got your patients, you've got 5 kids and 4 dogs and 6 cats.
Chaos. That's my
Okay.
state of mind.
Okay. Well,
Yeah.
all right. So if Dr. Cat can do it, we can do it. Okay, folks. So just saying that. All right. Well, let's move into now then with React 19, the Revive Clinic. This has been let me see if I can bring up those notes that I have. Okay. So the Revive Clinic aims to bring healing to people suffering from complex chronic illness. Patients are evaluated by board-certified medical experts from numerous backgrounds who work collaboratively in this innovative and independent center for excellence for specialized care. Here at Revive, we strive to be a beacon of hope for those who have struggled to be seen, heard, and believed. And let me just say, now this is, as I talked to Joel yesterday, that you guys are impatiently trying to be patient, waiting for your status to have this go into effect. Obviously, for anyone familiar with React 19 knows of Joel Walskog, Redressen, the co-founders, and how they're just trying so, diligently to get people to be seen, heard, and believed, get the help that they need, the medical help they need, the testing they need. And so they're trying to open this clinic and in Texas, and you are a big part of that. So can you tell us what you know about that?
So, we got together the Global COVID Summit group of physicians and React 19 with this idea of creating a clinic that would deal with these complex chronic illness issues that we are seeing now in the wake of what has happened. We created a nonprofit, and we're going through, the paperwork and things. And the clinic will be in Texas because that's where I'm at. I'll be the medical director, and we will approach every patient as an individual, because one of the things that you find in this world is there's when it comes to like vaccine injury in particular, the COVID-19 vaccine injury, every person is different. And maybe even to people who have similar presentation respond totally different to things.
Right.
I think one of the important things to say is, this is my opinion, but I know Joel and Bree share it from our conversations. There's no cure for it.
Right.
There is no antidote right now. There is no detox for it. I hate the word detox because to me, detox implies that once you detox, you don't have it anymore.
Right.
So there's only a way of figuring out a way of how to mitigate symptoms and improve the quality of life. And for some, you do it for a certain amount of time, they're 1 and over, and they just maintain their lifestyle, take care of themselves.
Right.
And then you have others who have suffered for a long time now with different sequela of what's happened. So the idea behind this clinic is to have, first of all, physicians who are committed
Right.
to making a difference, work directly with the vaccine injured and getting input from the group on things that they've seen and things that they have worked for other people, and find gold standard if possible in how to approach different things.
Right.
And also create a little bit of a gold standard in pricing as well. Because as people travel around the world or US, you go to different clinics, everyone is kind of doing different things. We just want to create a environment where we're doing good. And, Joel and I talk all the time, Bree as well. So our hearts are into this.
No.
We're going to do everything we can to make this successful and work for everyone. So it's a journey. We just have to be patient. That's where we are right now.
And I think, Joel, we're not going to stop till we win. I love that attitude, especially from somebody who's, lost his entire, I'm assuming everybody knows this, but Joel Walskog, who was an orthopedic surgeon, a very successful and beloved orthopedic surgeon, after one Moderna shot, lost it all with transverse myelitis. And has never been acknowledged by the CDC. I mean, so not only does he know the plight of the vaccine injured, he knows the medical system. And so, but I have interviewed many vaccine injured people, and I got a text from somebody last night, and just what she was going through, and I'm thinking, like, where do they go? And so when you say, we just need to have time and hope. So what would you say to that person, the person who's listening in, who's been at this for 3 years? Some of these people, they've lost all their money. They've spent their entire life savings trying to get well. They're going around looking for places, and they're just like, is there going to be any hope for me? So speak to that person that feels like, I'm never going to get out of this.
So first thing I would want to say is, especially with Revive Clinic, you have this whole army of physicians who are committed in making good.
Right.
The whole Global COVID Summit core group of physicians, and we have pediatric cardiologists, pediatricians, family medicine, functional docs. We have ophthalmologists, Dr. Urso, Dr. Ryan Cole. You have all of these people behind it. And then with the C19 React experience,
Right.
stories and things that they've done combined together, like I said, our hope is that we will really make a difference and try to find answers for what's happening. I know it's very difficult for especially the ones who are now in the acute and chronic phase of their illness, where they're having flare-ups and things like that, say, well, I can't wait. Good things, there are a lot of good doctors out there. Dr. Molly James is doing amazing stuff.
Oh yeah, I'll put her link in there.
Yeah, Dr. Molly James is awesome. Dr. Mary Talley Bowden in Houston. And the good thing is, like, we really talk all the time. So if someone thinks something works, they're like, okay, try this, do that.
Right.
And
I think that's it. Maybe it's just to know, the cavalry's coming. We're getting there. We're so much further.
Merrick,
we're
Dr. Paul Merrick is also going to be, so I'm sorry. I was just going to say, Dr. Paul Merrick is also going to be important part of this because of his research.
Definitely.
He loves to go research and read different things and say, we should try this, do that. So hope is on the horizon, but I do know
is
that
on the
a lot
horizon.
of people people are suffering now, and we need to be able to address that. The best advice I can do is, find your tribe, find your home, find your family, ask for help whenever you can, reach out to React 19 in particular, because they might be able to give some guidance.
Right. In the last couple of weeks, I've just interviewed Jack Nygren, who is the head of the Prayer and Spiritual Encouragement team. So I'll link to that in the show notes. And then Julie Woods, who does the support groups. So React 19 does have support groups. Please reach out to them, that they want to help. And so maybe they can carry you through, until all these other things unfold. And I have to make a pitch here that I heard Bree say that the Biden administration has allocated $10 billion for the uptake of, advertising, propaganda for the uptake of COVID vaccines. And so we're going to be inundated with all of this information to go get the vaccine again. For anybody who's potentially listening, who might have $1 million or $2 laying around, or anybody who's got $50, $10, $80, I'm going to put a link in the show notes to give to the CARE Fund and for React 19. And remember, every single dollar goes right to the injured. Nobody takes a dime in this organization. So okay, I know this is going to go directly to somebody who's just hanging on. And so I'll put that in. And so, well, you have been a wealth of information. I'm going to send everybody your way and to all your sites. So I think, was there anything else before we sign off?
The only thing I would like to say is it's really important to kind of return back to that common sense way of life. You know, the way you can fight back, for lack of a
Right.
better word, is, you know, start at home, start with your family, start with your community, get involved with your kids' school or in a place of worship, you know, run for these little offices in your county, in your town, because that actually matters more than what's happening on federal level.
So true.
Support people that share your same values, you know, learn how to grow food at home and little things like that, because you can get your kids involved. There's so many things we can kind of decentralize away from this system that's trying to pull us more
Right.
and more to this, you know, one central unit. Um, and you know, if you believe, I think prayer is important. Like I said, try to give each other grace. Try to find reasons to laugh, you know.
Oh,
And
that's a good one. That's a good
yes,
one.
like I said, you know,
Ah,
you
that's a
had me
good
going a little bit to the World Health Organization for a while because it's kind of ironic
one.
what they're trying to do to us all and thinking they're just going to get away with it. But I do believe in power people 100%. You know, if I didn't believe that we can do this, I would probably be very depressed and not smiling much. But I believe in faith. I believe in, you know, there is a journey for all of us here. And I remember someone sent me through my website, my practice here in Texas is eaglemedcenter.com, and you can send me a message through that. And I see them all and I do respond. But someone sent me a verse early on in this um, you know, journey during the pandemic, and the verse was, you know, the simple verse is, perhaps you were made for such a time like
Time is
this.
this. Yes. Yes.
Yeah, and I think
Yeah.
about that verse a lot, and I read, you know, that whole um, chapter, and it's true. You know,
Right.
we are living in the time where we're supposed to live in, and we all have a part to play, and we
Right.
should just play our part.
Oh, that's a great way to end. We should all just play our part. So on that note, everybody go out, be encouraged to play your part. Thanks so much for talking today, Dr. Kat. So appreciate it. Everybody check out the show notes. And until we meet again, thanks.
Thank you for having me. It was my pleasure to be with you.